Welcome to the 2026 OncoAlert Colloquium. My name is Allison Rosen. I'm a colorectal cancer survivor and very passionate advocate. I'm going to give you my perspective on some of the things that have happened in colorectal cancer in 2026 and some exciting things to come. Before I do so, I wanted to quickly introduce myself and who I am. Not only am I a 14-year colorectal cancer survivor, I've also worked in oncology and research in public health for many, many years. So I have a unique perspective, and my goal has always been to help bridge the gap between researchers and clinicians and the communities that they serve. So I like to use my story and my experience to help others in the field as well as advocacy organizations. So a newer picture for me is showing my ostomy off. Phil, my ostomy, has a lovely cover that says check your colon. So I will do anything to spread awareness about the importance of screening and early detection for colorectal cancer. Some of the words around me are really, really important, especially as a patient survivor and especially as a long-term survivor. Physical aspects of cancer are important, but after 14 years, I realized that you have to take care of your mental health. You have to make sure you talk about sexual health. You have to make sure you talk about body image, and all the physical things will be addressed. But making sure you have initial conversations with your doctor about all the things that relate to the cancer and the treatment that you're on are so, so important. To this day, I still get hydration infusions because it really helps me with an ostomy and organs that have been missing for a while as a result of some of my surgeries. So all of these things are important when you're taking into account a lot of the trials, a lot of the treatment, and a lot of the research that you'll hear about from some of the healthcare providers today. So a few things that I'm going to talk about. I'm going to go very, very quickly through some things that I think are important. And I know that some of the other presentations have covered or will cover some of these important topics. So hot news, hot off the press. Not really. We've been talking about GLP-1s in the world for as long as I can remember, at least over the past year. And now it's been shown not only in breast cancer, but in colorectal cancer to reduce the risk of developing colorectal cancer. So expect patients and caregivers to bring this to your attention if you're a healthcare provider listening, because I think that it's something that people will bring up. Not only can they lose weight to help and decrease incidence of colorectal cancer, but just get back healthy. If they're a patient that has lost a lot of weight, this might not be for them. But ultimately, I think if you compare the positives to the negatives, this is a conversation you're going to want to have with your patients. And again, I know they'll bring it up because it's been in the news. So something that came out, again, another update at 2026 ASCO GI that I know, again, the providers and researchers that are presenting will talk more about, but Breakwater and Dr. Kopetz and his research has been practice changing for many of us in the colorectal cancer field that are going through treatment currently. Lastly, and something I was grateful to be a part of, there was a talk at ASCO GI on survivorship where Dr. Shruti Patel used some quotes from patients and survivors that I helped collect to really nail down the importance of early onset colorectal cancer being looked at as a whole person care. So tackling social work, genetics, palliative care, OBGYN surgery, it's really all teams on deck, especially with the rise in early onset colorectal cancer. And as of today, I think the American Cancer Society came out with the facts and figures that showed colorectal cancer is a leading cause of cancer-related death in men and women. So this is even more important. And I loved how she tackled some of the topics that are so, so important that aren't often brought up, maybe by us, but maybe not. Fertility and sexual health, conversations that need to happen at that first appointment to understand your patient and what they really care about once you start treatment. Family planning, life, quality of life, all are important factors when you're talking about treatment and treatment plans. And I will end with what's coming up in 2026. The keynote talk at ASCO GI, I was moved by it. I think it's the future of clinical trials, the futures of oncology, and especially early onset cancers. Dr. Rathmel emphasized the importance of providers building effective collaborative partnerships with each of their patients to ensure they have what they want, and when they need it. And I think that's so important. I think shared decision making, provider and patient equals the best care possible. What might be important to me might not be important to someone else. It depends on age, stage in life, where they see their life. Do they have children? Do they work? Do they not work? There's so many factors coming into account or that are important for different people. So clear communication is so, so important. But then also, I think dyad care, she mentioned that bridging the divide that leads to disparities in cancer care in rural America. So making sure that no matter if you're by an NCI designated cancer center, you get the same care as someone that's in a rural area or not close to an NCI designated cancer center. And I think everyone working together is how we're going to increase access to clinical trials and decrease that mortality and incidence that you saw in colorectal cancer that's come out, but also all young onset cancers, because that is on the rise and that is very, very scary to me and so many others I know. So ultimately, I want to say thank you and letting me provide the patient perspective. And I'm always available through social media and whatnot to be a partner because we can't do this alone. So patients, advocates, clinicians, researchers, and everyone alike within the healthcare realm, nurses, navigators, community health workers, we all have to work together to ensure the best care possible for your patients. Me being one previously and still being one for life, because I'll be dealing with survivorship forever. I'm grateful to be here providing the patient perspective and grateful for everything that you all do.